Welcome, healthcare professionals and community advocates, to an exploration of post-exposure prophylaxis (PEP), a powerful tool for HIV prevention among injection drug users (IDUs). Embark on a journey with us as we delve into the significance of PEP for IDUs, its effectiveness, and the importance of equitable access to this life-saving intervention. HIV and injection drug use, a critical intersection. Injection drug use remains a significant risk factor for HIV transmission worldwide. Sharing needles and syringes, the common practice among IDUs, can lead to the direct transfer of bloodborne pathogens, including HIV. The prevalence of HIV among IDUs is substantially higher than in the general population, highlighting the urgent need for effective prevention strategies. PEP, a shield against HIV infection for IDUs. PEP, or post-exposure prophylaxis, offers a critical safety net for individuals who have been potentially exposed to HIV through injection drug use. PEP involves taking a combination of antiretroviral drugs within 72 hours after potential exposure, ideally within 24 hours. The effectiveness of PEP for IDUs. Clinical studies have consistently demonstrated the effectiveness of PEP in preventing HIV transmission among IDUs. Studies have shown that PEP can reduce the risk of HIV infection by up to 90% when taken correctly and promptly. PEP accessibility for IDUs, addressing barriers. Despite its effectiveness, PEP remains underutilized among IDUs due to various barriers, including limited awareness and understanding of PEP. Many IDUs may not be aware of PEP or its potential to prevent HIV infection. Stigma and discrimination. IDUs often face stigma and discrimination, which can hinder their access to healthcare services, including PEP. Logistical challenges. IDUs may face logistical challenges in accessing PEP, such as transportation difficulties or limited access to healthcare providers who are knowledgeable about PEP. Overcoming barriers and expanding PEP access. Addressing these barriers and expanding access to PEP for IDUs is essential for reducing HIV transmission in this population. This requires community-based education and outreach, raising awareness about PEP among IDUs and their communities through culturally sensitive and accessible education programs. Training healthcare providers, ensuring healthcare providers are knowledgeable about PEP and its specific application for IDUs. Integration into harm reduction services, integrating PEP into existing harm reduction services, such as syringe access programs, to make it easily accessible to IDUs. Addressing stigma and discrimination, implementing interventions to reduce stigma and discrimination associated with HIV and injection drug use. PEP as part of a comprehensive approach. PEP should be considered an integral part of a comprehensive HIV prevention strategy for IDUs, which should also include PrEP for those at high risk of ongoing HIV exposure, promoting PrEP, a daily preventive medication, for IDUs who engage in frequent injection drug use. Harm reduction programs, supporting harm reduction programs that provide sterile syringes, naloxone overdose reversal medication, and counseling services for IDUs. Addressing substance use disorders, providing access to evidence-based treatment for substance use disorders to reduce the risk of HIV-related behaviors. Addressing social determinants of health, such as poverty, housing instability, and lack of access to healthcare, which contribute to substance use and HIV risk. Empowering IDUs for collective prevention. Empowering IDUs to take charge of their health is crucial for effective HIV prevention. This involves peer-to-peer education, empowering IDUs to share information and support about PEP and HIV prevention among their peers. Self-empowerment workshops, providing workshops that teach IDUs about HIV prevention, harm reduction strategies, and self-advocacy skills. Advocacy for policy change, supporting IDUs to advocate for policies that promote equitable access to PEP, harm reduction services, and substance use treatment. PEP, when combined with comprehensive HIV prevention strategies and community empowerment, has the potential to significantly reduce HIV transmission among IDUs. By prioritizing equitable access to PEP, addressing the underlying factors that contribute to HIV risk among IDUs, and empowering IDUs to take charge of their health, we can work towards a future where IDUs are free from the burden of HIV.